but I liked it. I liked it, and I never applied for the medical school again. I mean, from what I felt was that I've always been driven by a desire to help others and to make a meaningful impact on their lives. I would say that the oncology nurse has a really unique role within the healthcare system because we have patients who are we going to get to know. Communication is definitely really important. It can be sometimes challenging to handle communication inside of the healthcare team.
Because this is the main idea of the, let's say, the healthcare, trust and hope. Hello everyone, nice to see you again at a new interview from the series Beyond the Cancer Diagnosis. Today our guest is Tihana Gašpert. She's lead nurse at nursing home in Croatia and Ph.D. student at University of Maribor. Tihana, thank you very much for accepting our invitation. How are you? How are things going?
Hello, Adrian. Nice to see you. Thank you for the invitation. I'm really honored to be a part of your interviews at OncoDaily. I'm really doing good today.
I'm I'm great. Um, I will start the interview with maybe uh, a common questions that I'm asking to all my invitates. Nowadays, the oncological medical staff become more and more, let's say, diversify. The team is multidisciplinary, and the role of the oncology nurses increased a lot nowadays. And the question is, how or why did you choose to become a nurse in general and oncology nurse in particular?
Well, to answer the question in the most simple way, I never wanted to be a nurse. I didn't even know what it meant to be a nurse. When I finished my high school, I originally put my application for medical school, and for my second space, I put nursing school because I thought that it is basically the same thing, but without the responsibility. And the tables turned that way that I wasn't accepted to medical school, and I was accepted to nursing school. I was really unsatisfied with that. I couldn't bear myself being in a nursing school. And I decided that I'm going to take the first year of nursing school to see what it's going to be, and then take the exams for the medical school again. But I liked it. I liked it, and I never applied for the medical school again. I mean, from what I felt was that I've always been driven by a desire to help others and to make a meaningful impact on their lives. But the tables turned that I got into the nursing school and not into medical school, and I wouldn't change it any other way. Why I became an oncology nurse? Well, in Croatia, we actually don't get to choose where are we going to work. They usually ask us where do we want to work, in which clinic or on which ward. But during my college, I was doing my clinical practice in oncology for a week, and I had beautiful supervisors there who basically made me fall in love into oncology. They really showed me all of the benefits, or all the things that can be done in oncology. And I knew when I finished that clinical practice that one day when I get a job that I want to ask for oncology. And when I get my first job, I asked for oncology. The interviewers were a little bit surprised because nobody wants oncology as their first opinion, and I really wanted it, and I got it. Because the oncology nursing is really a place where you can make an impact on patients' lives and their families' lives during their most challenging times of their lives. And also, the field of oncology is now constantly evolving with new both treatments and research, which keeps me intellectually stimulated and allows me to grow as a healthcare professional.
I want to turn a little bit back on your answer on becoming a nurse in general. I don't know in Croatia, but in Romania we have now, since few years, a faculty of nurses,
Yes.
which is 4 years, and the medical school is 6 years. So it's quite not the same, but it's something very, very serious treated. In Romania, I saw now that in Croatia and I guess all over Eastern Europe, as regarding the oncology nursing, um, we are talking about the multidisciplinary teams that, especially in the development countries, we can see it more often. The nurses has an important part, and it's like a liant or core to facilitate the dialogue and collaboration among healthcare providers, and it's like something that unite the team to work together toward the common goal, which is to help the cancer patients. From this perspective, I will want to ask you what duties um, has an oncology nurses, or what that she needs to do in particular.
Yeah, for being a nurse, an oncology nurse, first of all, it is the base is the same as being a nurse in general, which is providing direct patient care. When we talk about specialties that are going in oncology and in oncology nursing, that is administering chemotherapy and other treatments, managing symptoms and side effects. A very important thing is offering emotional support and as well education patients and their families about the disease and treatment options. As you said, oncology nurses play a crucial role in coordinating care among different healthcare providers, ensuring that communication is clear, and she has a vital role in the multidisciplinary teams where they are working towards a common goal. Also, they are really there for patient in terms of advocating their needs and preferences, contributing for a more personalized and patient-centered approach to care.
As you speak, I'm thinking and I'm imagining that it is a lot of pressure uh, in uh, in the hospital dealing with the caregivers, especially in the operating room. A lot of stress, and therefore, which qualities uh, um, do you need to have to be an oncology nurse, other than, let's say, not regular nurse, but oncology nurse?
I would say that the oncology nurse has a really unique role within the healthcare system because we have patients who are we going to get to know. Those are the patients who are constantly returning to either day hospital or wards. So we do get that unique opportunity to really get to know the patient, each patient and their families, and I think that that is a huge blessing for each oncology nurse. And within that, the nurse, of course, has to have some kind of qualities that may be different from the other nurses in other wards. So in that terms, I would really focus on compassion and empathy because patients often face significant emotional and physical challenges. Then the nurse has to have strong communication skills, which are crucial for explaining a lot of complex medical information and providing emotional support. And the other qualities are critical thinking and problem solving abilities to manage the complexities of cancer care and treatment. And last but not least, nurses who work in oncology setting, they're often faced by looking of a lot of side effects and a lot of deaths, unfortunately. And she has to think of herself. And I think that the another skill is resilience and ability to handle stress, giving the emotional and physical demands of the job.
After all these qualities, which are not like for everyone, you have to be born with them because they are not qualities that you can acquire in time. I would like to ask you, because you mentioned communication skills and the communication in cancer care, which today it is huge problems, and they are different ideas, different point of views, how we should do, by who that it should be done. And I want to ask you, with whom it's harder to communicate, within the medical team or with patients or with
Well,
their caregivers? Because it's not the same communication, but you are the same person, and
yeah.
sometimes, yeah, things are changing.
Yeah, things are changing. I would say communication is definitely really important. It can be sometimes challenging to handle communication inside of the healthcare team because nowadays nursing is really evolving, but we've known that for a last, I would say, decade or 2 decades, the nurses were doctors' assistants, and we didn't have a lot of things to say. We couldn't say a lot of things. But
Liberty
now,
to
yeah. Yeah, but now things are changing and nurses are really an official members of multidisciplinary team. We have our voice inside of a team and our opinion matter. And I would say it can be challenging, but I think that we can overcome these challenges because we do have a set of skills, competencies, and we do educate ourselves on daily basis. When it comes to communication with patients and their families, it requires patience, empathy, and communication skills. Every patient is individual, and we must think about that. And we also have to have that in mind every time that we communicate with patient, because we must be adapt to listening to patient concerns and providing clear and concise informations. Of course, we're going to face patients who are sometimes hostile, who are in denial, but what we have to think is that we have to stay calm to provide support, and we have to build trust, because if our patient don't trust us as a professional, we are not going to get anywhere. And we have to understand the patient perspective always, because we are people. All of us have different perspectives and different views of everything, and that also includes the patient care. And we have to bear in mind the patient perspective, and have to find a common ground which can help them in guiding them throughout their treatment journey.
um, you mention empathy, and you mention trust. These are like human qualities. I had an interview with a survivor, Camille Moses, her name, and she's 12 years now, a survivor of pancreatic cancer stage 4. Wow, this is a performance, and she has such a force to fight. And during the interview, she wanted to thank the nurses and all the team of nurses, because they were the person who gave her the power to move on, because she saw the doctor once, twice a month, but each day she was working with nurses, and she was a very, let's say, she said that all her life she will remember the persons, and now they are friends and they are doing things together. And I guess there is nothing more satisfactory than a feeling like this. But you love your job, you love what you are doing. I'm a oncologist in Romania. I'm loving what I'm doing, but now we are in the face like a paradox that um, uh, there is an increased demand for nurses, as you mentioned, with a liberty or a freedom or an area of, let's say, management higher than before, but there are no candidates, or there are not enough person who wants to be a nurse, even though today there is a unique opportunity for some of them. What do you think it's happening this, or where is this paradox come from?
About the
The
lower number of
increasing
nurses.
demand of the nursing and decreasing number of person who wants to be nurse.
Yeah, I think it's a challenging question. Um, we've seen, and there are beautiful examples how nursing can be seen and what are the position for nurses inside of medicine and healthcare in general. The good examples of it is United States, United Kingdom, and I would say Australia. And we can see that there are positive changes and there are amazing opportunities for nurses. However, when we think, for example, if we look at Europe, we're looking at the decreasing number of people entering the nursing profession, which can be concerning. I think that there are solutions. The first thing that I think that nurses are really thinking about is how other people can value us, because sometimes we can see that nurses don't value themselves. And if we don't, as a profession, value ourselves, how can we expect others to value us? So I think that the crucial step is to create an opportunities for nurses not to be just at the direct patient care at the bedside, but also to have a position for education, for mentoring, for supervision, even to be on the board of hospitals and universities, to be a part of to have their job as part of managing just the clinical trial or just the research area. I think that we need to create unique positions for nurse, because for example in Croatia there is a situation, you can be just, I would say, just a nurse, but when you get into the job, you're being employed as a nurse, and that could be in a variety of things, but basically you're doing 90% of your job at the bedside, and the other 10% is whatever else you manage. But basically you educate people, you're having lectures, research. You have to do that on your free time. But if we can incorporate those things into the work, I would say that the nurses would feel more appreciated and more valued, because we've seen the reports. Report is from America, but we've seen that nurses, when they make a hierarchy of their demands at the job, the salary is not the number one. It is about the working condition. It is about what can you do effectively to at that job and how you can contribute to that job, and how
But,
are you going to feel afterwards. Yeah.
what you can give back to the community where you
Yes.
come from. And
Yes. Yes.
also from my experience as a psychologist, I saw that somehow the problem is in the middle between the, let's say, the infrastructure, as you
Yes.
mentioned, to offer you not only a simple position of nurse, and also from the other side of the person, because if you don't have confidence in yourself, if you don't have charm, empathy, and if
Yes.
you don't have resilience, you don't. It's better not to go. And now comes the questions about artificial intelligence that
Yes.
everybody is talking about e-health, telehealth, artificial intelligence, that I don't know, in the next few years it will replace persons and etc. And I don't believe this, because
Yeah.
never artificial intelligence can replace empathy or sympathy
I agree.
or charm, but is also a danger of artificial intelligence that maybe a part of the nurse job can be replaced by artificial intelligence. So what do you think about, let's say, the next 5 years in these fields of nursing oncology
I
regarding
yeah.
artificial intelligence?
I would personally like more of artificial intelligence in nursing, and I will tell you why. Because, for example, artificial intelligence can be great in data analysis in administrative tasks. Because uh, if you ask, I think, any of the nurse, she would say that she would love to spend more time by her patient side than by the computer. And if we can get the AI to replace us in those administrative tasks, in data analysis, diagnostic support, and data driven insights, it would be amazing. That would mean that me as a nurse would have more time to be next to the patient and do the job that I learned how to do, instead of spending most of my time next to the computer entering some kind of data and collecting things and not seeing patient in person, because those tasks by the computer takes most of our time. So in that terms, great. Do I think that the AI will replace nurses or doctors or psychologists? I don't think so. We need human qualities in healthcare, because we need to have patients to be comfortable, because they're all facing, no matter if they do have oncology diagnosis or any diagnosis, when they enter the hospital setting, they're stressed and they need someone to be by their side, and giving them that psychological um, support to being by themselves, that is also great benefit to their treatment. We have a lot of studies who confirms that. So I don't think that AI is going to replace us, but it can definitely help us in those tasks that are, to be quite honest, boring.
Yeah, because this is the main idea of the, let's say, the healthcare, trust and hope, because the medical staff should give every patient hope. You enter the on the door of the hospital, you can find hope, you can find trust, you can find somebody that really cares about you. And from my opinion, uh, as far as I saw in working also in the hospital with patients, there is another problem with nurses in general, oncology nursing in particular. You can't have time, how to put it, to evolve with the patient disease, because the number of patients is very it's increasing.
Yes, it is.
uh, and all the time you are starting your job from zero. You don't have a patient from day one until he leaves the hospital. And I guess this is very, very frustrating because you can't observe him, and maybe he have trust in you, and you can't offer him what
Yes.
you are meant to offer. And
Yes.
I guess this is the main problem. And I'm agree with you that artificial intelligence in the part of administrative and data science and so on, it is a very, very good instrument, and it will be very useful. But you can never replace human quality. You,
Yes.
we are not robots. We have feelings, so this makes the difference,
Yeah.
especially in cancer care. Um, Now that we don't have too much on our interview, I will like to talk about you and your personal, let's say, or professional projects, because um, I know that you are now co-chair of the new special interest group of IPOS,
Yes.
which it's called Early Career Professionals in Psycho-Oncology. Can you
Yes.
develop a little bit or tell us what is this CIG about?
Yeah. Okay. Yes, definitely. I am in the last few months. I have been given the opportunity to be the co-chair of the Early Career Professionals in Psycho-Oncology, and as a co-chair, along with my chair Amanda Belakursky, our goal is basically to advance the field of psycho-oncology by supporting the early career professionals in their development. That will include creating opportunities for education, for mentorship, and networking. What are we going to try to do is to promote research and innovation in psycho-oncology with addressing psychological and emotional aspects of cancer care. Also, what we wanted to do is organizing webinars and to have our part in the IPOS yearly conference to share knowledge and best practices, as well as advocating for policies that support the integration of psycho-oncological care into the standard oncology practice, and by fostering a supportive community, because we do have a great I would say committee who is created from members from all over the world, and we do have a huge community, and by fostering that community we hope to improve the patient outcomes and enhance the well-being of both patients and healthcare providers.
Wow. So very interesting projects, and
Yeah.
uh, yes, and hopefully, and I hope that they can be put in practice. Of course, there is a lot of uh, things to manage to do. And as the last question, um, you or your co-chair, you will be present at the IPOS conference in Maastricht this year in
I
order
know
to
that.
promote the SIG.
Yes, yes, of course. At least one of us is going to be present there, and we are already discussing the possibilities of having a face-to-face meeting there, so that we can meet each other. I mean, it's always challenging thing to get at in one place people from all over the world. So we think that the opportunities to be present at the IPOS meeting in Maastricht would be an amazing thing, not only to listen to the knowledge of other more experienced people than us, but also to get to know each other and to create future projects.
Yeah, because as we talked earlier about artificial intelligence, e-health and webinars are very good, but I always prefer face-to-face meetings because we talk about human qualities and you can feel the warmth or the goodwill of your partner. And this is very important in creating a stable and strong partnership during the time. Great. Very, very interesting discussion with you, Tihana, today. Thank you very much. And
Thank you once again.
I hope we'll see each other in the future,
Yeah.
maybe after 6 months or 1 year of SIG activities to see the results. I guess it will be interesting.
Yeah.
Thank
I
you very
really look
much.
forward to it.
Thank you very much, and I hope you enjoy being with us today.
Yeah, thank you.
Thank you.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.